I want to go over fitting of the brace, the Catalyst Propel and Propel Away knee brace. I want to make it easier for the patient and for the fitter on how to apply the brace properly. So the two most important things I look at is where number one strap is positioned on the calf and where the hinges are positioned at the knee. Now, positioning at the knee. Again, always make sure the brace is sitting as posterior as possible. Easier way of doing this. If I cannot see underneath the pad at the knee, that means the hinges are sitting back in the proper position. If I can see underneath the pad at the knee, that means the brace is sitting too far forward. You're going to get shin pain. The brace isn't going to function properly. So make sure that the hinges are sitting back as far as possible. Now, number one strap. Number one strap is the anchor strap. Okay, it's the most important. If it's not in the right place, the brace will tend to slide. Easiest way of doing this, and this is different from what our instructions are in the pamphlet. I want that number one strap to be up as high as possible, air on too high, the calf muscle. When I feed the strap through, I bend the D-ring and I slide it in. Now what I'm going to do is I'm going to pull the brace up, and I'm going to pull it up, make sure it's in the right position, and I'm going to go as high as I can till I can't go any higher. Then I know that the brace is sitting high enough on the calf muscle. From there, I'm just going to snug the brace, okay? You do not ever want to over tighten the straps on a brace. So now when I get up to walk and the muscles drop, gravity, the muscles will drop, the brace will drop and anchor on top of the calf muscle, eliminating chances of slippage, okay? From there, you're gonna follow the order of application. So number one was the top of the calf muscle. We're gonna go number two at the bottom, number three, number four, and number five being the last. So now you just want to snug it up. Rule of thumb and tightness of straps. The theory, the tighter the more support, is a really bad theory. You do not want to restrict the muscles from moving. That can fatigue the muscles, can cause muscle atrophy. You just want it snug. And I'm going to show you when I stand up how tight they should be. Okay, so we're going to go to number three next. Going up the leg. And number four. Okay, so the back is in position. Now, number five strap. Same thing, you do not want to over tighten it. What you want to do is you want to just pull it that you get a little resistance. If you pull it too tight, the hinges will shift to anterior. So just a little bit of resistance. So what I get is I get my patients to stand up, okay? They're going to feel the brace drop. That's normal, it's dropping in position. So take a few steps, walk around, let the brace drop into position. Once it drops into position, readjust the tightness of the straps while they're standing. Okay, the muscles are in the position where they should be when the brace is doing what it's supposed to be doing. So all I want is down the middle of the strap is that I can get the tip of my finger in there. Why that is, when you do activities, anything, exercise, just walking, your muscles expand. You have to give room for it to expand. So by a finger tightness, that will allow the muscles to expand properly. So any adjustments, always adjust the back straps first. So I always adjust number four, number three, and number two. Never touch number one. It's anchored. If you were to loosen it now, the brace would slide down. So you leave that tight, okay? Readjust the tightness. Once the back has been readjusted, then you're just going to tighten the front strap. And again, just a little resistance. See how the brace moves a bit? That's as tight as you want. Now it's ready to go.